Hi there, it's Dr. Scott Glocke. I'm an upper cervical chiropractor here in Yarmouth, Maine, and I'm going to do a tip of the week this week on some things that have been kind of going around lately with regards to stress, trauma, injury of the body. And we had a patient that came in, and this was a couple weeks ago, and she was kind of doing her thing, getting ready in the morning, and she took a step backwards, and she ended up slipping backwards and hitting the back of her head on the stairwell. And when she did that, she was having some kind of, almost was knocked out a little bit, was kind of unconscious for a few seconds, but after started to have some, no major symptoms, nothing like a real bad headache or anything, just kind of went through the day. About 2 days later, she started noticing some significant vision problems, sensitivity to hearing, headaches, dizziness, ringing in the ears, a whole bunch of crazy stuff. Went into the doctor. The doctor said she had probably had a concussion, and the concussion protocol is basically just kind of just sit and chill, no stimulus, no TV, no reading, nothing for a few days, and then gradually increase the stimulus as they feel better. And it really wasn't helping too much. That watch and wait process is a very difficult process for us as upper cervical doctors because we want to get that area corrected as soon as possible if there is a trauma. And that's exactly what happened with her, is that when she hit her head, that upper neck area, rather than being balanced, it was actually kinked off to one side. And when it was kinked off, it puts pressure on the spinal system, and that was causing some problems. And when there is damage to the spine, you're going to get inflammation. Just like if you twist your ankle, it's going to swell up, it's going to get inflamed, maybe some tension, pain in that particular area. When that happens within the spine, there's not a whole lot of real estate there. So if you get inflammation around the spinal joints, around the nerve, you're going to put a significant amount of pressure in that area, and that can cause a lot of problems. So that is why when you're dealing with head traumas, neck traumas, even something relatively small, I want to make sure that it gets checked, because if there is an area of misalignment, that can cause problems down the road. So if you do have a situation where you know of a friend or family that does have a head or neck trauma, sports injuries are very common. You want to make sure that they get checked by an upper cervical doctor, and that's something we specialize. We deal with a lot of neurological rehabilitative places, a lot of neurologists in the particular area here, because we do something where there's that area of misalignment. We very gently, precisely correct that area, allowing for the body to function right. So I just wanted to give that little tip of the week this week. Please pass this tip to others, especially when it comes to head and neck trauma. It can really make a big difference for them. If you have questions, we're going to schedule a consultation. You can call us at the office at 846-5100. Thanks again.